AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher with a guest in studio from Central District Health Department, Colette Evans, that comes by to bring us up to date on a number of things. And this time we get to talk about something for your kids. First, welcome back.
Thank you.
Is it warming up?
No.
Oh, okay. Well,
It's
at least
very chilly.
And you're officially up to date. National Children's Dental Health Month is coming up, and having been one of those kids that wasn't very good at dental hygiene growing up, I've paid the price over my years, and I still do once in a while, but the recovery is slow, but it's coming. We can head off a lot of that if we can teach kids how to be better at taking care of their mouths.
Absolutely. One of the things that we do with the kids that we serve is we not only educate them on appropriate dental hygiene, but we provide education to parents as well on the importance of children brushing their teeth, starting from infancy. We show them how to take care of the infant's mouth after like feedings or some of those things. But that dental care really does start right away, and it's incredibly important, as you mentioned. We've seen a number of children who have not had any dental care at all, and they come in, and when we're providing an exam for them, we are seeing their roots. Their teeth are completely broken, and they have lots and lots of infection. And so we really use that information to try to educate the people that we go out and talk to about this is what happens when the dental cares aren't being met or taken care of, and kids aren't brushing their teeth, and that's not made a priority. One of the things with not taking care of your dental needs is it doesn't just impact your mouth. You can get infections that can travel to your brain. It can travel to your heart. Believe it or not, it can lead to diabetes. So there's so much more involved in dental care than just making sure people are brushing their teeth. We really want them to be getting their dental visits in every 6 months. We have a program at the health department called Healthy Smiles, and we provide an exam, a cleaning, fluoride varnish treatments, and sealants to children and even adults who need some of that fluoride varnish treatment. And we provide that at no cost. We do go into some of the schools in our area. We will be going into some long-term care facilities because elders are another population of people that don't get the services that they need when it comes to their dental health care. So we do that, but we also have in-office clinics. And right now we have a pretty long waiting list for children and WIC moms who are on WIC and they're pregnant. We have a pretty long waiting list, but we're really hoping that with summer coming and not having to work around school schedules that we'll be able to catch up on that list.
And you can get on the list, so you go ahead and make your appointment. And let's face it, when it comes to any kind of a healthcare provider, you're going to be making appointments coming up. It isn't a case of just walking in and I need the help right now. I mean, if it's an emergency, they will do everything they can to meet you. But if you're setting up an appointment and trying to potentially reestablish your positive habits for your lifetime, for the future, it's worth the wait. It's worth getting that appointment.
It absolutely is. We really work hard to make sure that we're getting everybody on our waiting list seen as quickly as possible by holding more in-office dental clinics in between our school visits. We see mainly children, and we do see moms who are pregnant and receiving WIC services. The services that we provide are free of charge. It's all preventive care. It does not take the place of a regular dental visit, but we do that preventive care piece, and we don't charge folks for it. We do ask for donations to try to support our program and keep it going, but it's definitely not a requirement. We're not pressuring anybody to provide any donation to us.
National Children's Dental Health Month is coming up. Colette Evans is here to remind you about the services available and the good habits that can be formed. And if you can get kids to get into this routine now, this literally can change their life.
Absolutely. Absolutely.
So keep that in mind. If you have questions, you can always check with Central District Health Department.
Please call us 308-385-5175. Ask for Jasmine.
There you go. Colette, always a pleasure. Thanks.
Thank you.
Good morning from AM 1430 KRGI, 105.5 FM.